Today we're going to talk about childhood obesity and the roles nurses play in the prevention of it. Did you know that in 2011 to 2012, 17% of children aged 2 to 19 in the U.S. were considered obese? And these numbers haven't changed much in more than a decade. That's 12.7 million kids. And 70% of obese adolescents grow up to become obese adults. It's no wonder that one of the Healthy People 2020 initiatives focuses on nutrition and weight status, and more specifically, reducing the proportion of adolescents aged 2 to 19 who are considered obese. The most efficient way to battle childhood obesity is to prevent it from happening in the first place. And how do we do that? With proper nutrition, of course. Good nutrition is important to the overall health and development of children. It helps them to grow to their fullest potential, and it provides them with an energy source to keep them active. It reduces their risk of developing many different medical conditions in the future, including heart disease, hypertension, type 2 diabetes, osteoarthritis, osteoporosis, and some cancers. Whether a child is being fed a diet that would be considered good nutrition is dependent upon many things, such as a parent's knowledge of and ability to make healthier food choices in meals. Can they read a nutrition label and understand the differences in and importance of the various ingredients? A family's financial resources to purchase those healthier food options. Can they afford the extra expense that sometimes comes along with buying the healthier food? Can they afford to buy any food? The existence of health programs at a child's school. Does the school offer the choice of healthier foods? Are there policies in place for health education and counseling? So what can a nurse do to help in all of these areas? Plenty. A child's environment at home and the influence of his or her parents play a strong role in the child's eating behaviors. Heard the phrase, monkey see, monkey do? Well, children learn from their parents what to eat and why to eat it. If the parents don't have healthy lifestyles, the child won't either. Targeting the caregivers provides the most effective impact. Educate the parent, teach the child. Nurses in doctors' offices and community health settings play a vital role in the education of parents in terms of proper nutrition. In their assessment of the child, the nurse can ask the parents questions to assess nutrition and possible deficiencies. Questions like, what is the child's volume of intake? What foods does their diet consist of? How often is junk food or fast food eaten? The nurse has the opportunity during these interactions to speak to the parent about any dietary concerns they have regarding their child's overall growth and development. This can be accomplished through open discussion with the parent about foods that are rich in fiber, the appropriate amount of dietary fat, the recommended servings of fruits and vegetables, avoiding foods that are high in sugar, and portion control. The nurse can help the parent set specific goals for themselves and for the child, like increasing the number of servings of fruits or vegetables consumed during the week, or reducing the number of times the family orders fast food or takeout for a month. The nurse can also provide pamphlets which outline the dietary recommendations set by the FDA, or if needed, they can refer the parent to a dietitian or nutritionist for further education. Whichever intervention is employed, however, it is important for the nurse to stress that parental involvement is paramount to effectiveness. Studies indicate that the higher the degree of parental participation, the greater the degree of success. One big roadblock for a lot of families is the lack of ability to purchase nutritional food items for their family. Food insecurity is defined as reduced food intake and disrupted eating patterns because a household lacks money and other resources for food. In 2008, 23% of all U.S. children lived in food insecure homes. In addition, lower-income neighborhoods have less access to supermarkets with healthy food options and more access to fast food restaurants and convenience stores. Not surprisingly, then, obesity prevalence was highest among children and families living at or below the poverty level. One way a nurse can help in this area is to provide families with information regarding the WIC program, a federal program for lower-income families found to be at nutritional risk. WIC programs provide nutrition education as well as vouchers which allow the family to purchase healthy food. A full health and nutrition assessment is completed so that the program is tailored to the individual family's needs. Education is then provided in areas such as dealing with picky eaters, preparing healthy snacks, and healthy eating on a budget, just to name a few. The WIC program also provides these families with vouchers so they can purchase healthy foods at no cost to them. These foods include fruits and vegetables, whole grains, cereal, milk, eggs, and cheese. Combine these food options with the education on how to prepare them, and you've got a recipe for healthy living. Obesity prevention doesn't need to be restricted to just the home. Children spend a rather large amount of time either at school or at school-related functions. In fact, students are at school approximately 6 hours each day for 13 critical years of their development. So it makes sense that school health programs could be one of the most efficient means to prevent or reduce risk behaviors that could lead to obesity. And while the school district would be primarily responsible for establishing the guidelines by which the school would operate in terms of its programs, a school nurse can be a major contributor to the improvement of the student body's health education in a variety of ways. They can serve as a liaison between the school and those at the school district who make the decisions in how health guidelines are developed and implemented. A school nurse could help develop health and safety policies and select educational materials based on the age of the group of children they are working with. School nurses could also teach health education classes and therefore have a hands-on role in not only selecting educational materials, but providing those materials to the students. Learning about a behavior through enjoyable, active participation activities is more effective than a simple lecture. The use of cartoons, dances, or skits might help promote learning in younger students. Older students might focus on personal goals and responsibilities, decision-making skills, and resisting negative social pressures. Lessons should emphasize the positive aspects of healthy eating, not the negative consequences of unhealthy eating. And because kids nowadays are practically born with iPads in their hands, computers can be used so that students can track their food intake and receive a nutritional analysis. This can be useful in seeing in black and white whether a particular food choice was the right one to make. School nurses could also assess a student's health needs during their routine interactions with them. They can evaluate the school program's impact by documenting any positive changes in the overall health of the students via any blood pressure changes, weight loss or gain, BMI, cholesterol, and blood glucose levels. Assessment also allows for the identification of students who may need additional counseling, or, in the case of a student with a possible eating disorder, referral to more specific mental health and social services. Counseling will involve motivational interviewing using a non-judgmental, empathetic approach. This will hopefully encourage the student to express their feelings, both positive and negative, toward eating, their body image, and any concerns or worries they have regarding their health. Involving the student's family may have a greater impact on the influences that shape the student's health behaviors while away from school as well. This will mean greater short and long-term success in the prevention of childhood obesity. Childhood obesity is a problem that should not be ignored. Nurses have many opportunities to provide tools and information people need to make healthy choices. We can educate them ourselves or put them in touch with resources they may lack. We can change the way they see food, which could help this Healthy People 2020 initiative become a success story. So what does this mean for us, the next generation of awesome nurses? Well, think about it. If one nurse can help hundreds of families in their career, imagine what this entire class will be able to accomplish. Change some lives? Absolutely. Change the world? Why not?